All right, welcome to another edition of At the Table with CASA, presented by California Association for Health Services at Home, with support from Access. Access is a leading global technology platform for healthcare at home, empowering more than 9,000 organizations to deliver care to over 5 million patients worldwide. So if you're serious about delivering high-quality care in today's environment, technology isn't optional, it's foundational. You can learn more at access.com. That's AXXESS.com. Okay, let's set the table for today's podcast. I think I said in the last podcast that I don't know anybody in home-based care who's saying, oh yeah, I got plenty of staff. I'm beating them off with a stick. I just can't take any more. It's exactly the opposite of that. So as demand for home health and hospice and home care in California continues to explode because we're aging at such a rapid pace, we're still struggling to recruit and retain staff, and caregivers are burning out, and reimbursement just doesn't ever seem to be keeping up. So the math isn't really mathing. Here's my concern. And I'm not trying to fearmonger here. I'm not trying to scare anybody. But if policymakers and stakeholders don't get a little more serious about things like workforce development, wages, policy alignment, that kind of thing, I wonder if we're not heading towards some sort of a breaking point. Again, not trying to fearmonger. I just know that these are the kind of conversations that people are having in home-based care on a day-to-day basis, and we want to at least talk about it and address it. Otherwise, we're just not being very authentic. Today, I'm excited about our two guests. They're both deeply involved in these kinds of conversations nationally and at the state level. They're both from PHI National, one of the country's leading organizations focused on the direct care workforce. Jake McDonald is Senior Policy Advocacy Specialist at PHI National. He works at the intersection of workforce policy, healthcare advocacy, and economic justice, helping advance policies that strengthen the direct care workforce and improve care delivery nationwide. And also Jenna Kellerman. She is Senior Director of Workforce Development at PHI National. She's a nationally recognized workforce expert focused on improving recruitment, retention, training, and career advancement for caregivers across the aging services and home-based care sectors. Did I pretty much hit that right, guys? People?
You
Sounds
sure did,
great.
Mom.
Yeah.
Yeah.
Let's get into it. I'd like to start with Jake, if I could. What are policymakers in general still not getting about home care, home health, and hospice workforce realities?
I mean, they're not getting a lot of it. I think in our work, we so frequently find that the best policymaker champions of home care are those who, you know, mom needs a caregiver and they suddenly realize, boy, it's really difficult to find a home care worker. And boy, I'm caring for mom on my own, trying to fill in the gaps. And it's really difficult. And I don't have the skills, I don't have the time to do this. And that kind of visceral understanding of how important it is to have a robust home care workforce and how many problems there are in it, as well as the connections between that and our larger economy. I mean, people having to leave their jobs and careers to care for a loved one because they can't access a professional home care worker is an issue that has a huge effect on our overall economy as well. So I think those lawmakers who run into that situation where they see it in their own family, it really opens their eyes. And so as an organization, we try to use data and research and stories to try to open people's eyes without having that kind of immediate experience with it. But I think to your question of what are they missing, I think we at PHI see this as a job quality problem. So yes, we're having trouble recruiting and retaining a workforce. And so we have looked at why that is, and we've tried different interventions to try to fix that.
Yeah. Yeah. Thanks. And thanks for having us, Mark. It's great to be here. Um, What we've looked at PHI, so we have, Jake's side of things is policy. We also have research and evaluation. We also have workforce innovations, which is where we're actually working to implement different workforce innovations. And bringing those three perspectives together, a few years ago, we came up with the 5 pillars of direct care job quality. So a lot of the work we do is really focused in these kind of 5 key areas, 5 pillars, 29 elements. But we focus on quality training. So recognizing that staff oftentimes are not prepared after they've finished whatever that initial training is, whether it's PCA, home health aide, CNA, those trainings were developed almost 40 years ago. And there really haven't been new frameworks for any of those credentials since.
Right.
So woefully out of date. The patients, clients that we see today are out of the hospital within hours. There's in same day surgical procedures. They're very acute. The mental health, behavioral health audience just looks a lot different today than it did 40 years ago. And so our caregivers are just not trained in the way they need to be trained. We also look at fair compensation as one of our pillars. And we can get more into this a little bit later, but living wage needs to be the base wage. There is absolutely no way to have a stable, quality workforce if they don't have stable home personal lives. You have to have access to a safe, stable home, to food, to childcare, to transportation if you're going to be a home care worker. And we don't have reimbursement mechanisms that allow for wages that are family sustaining. Another one of the pillars is quality supervision and support. Um, we have a lot of work to do in this area in providing supervisors with quality skills. We typically, which is common, I think, in every sector, but we promote people based on the years they've been working, based on their clinical skill, and not based on their ability to lead others, to coach others.
Mhm.
And so we've got a ways to go there. The fourth pillar is around respect and recognition, and I think this is an organizational issue, but it's also just a societal issue.
Yeah.
Our society doesn't care about direct care workers. They don't care about caregivers. They don't care about aging, people getting old. And so because our society is built like that, it's really hard.
Right. But why is that? That's actually one of the things I wanted to pursue, and you might have answered a little bit of this already. I wanted to talk about reimbursement, but
Mm.
oftentimes we hear about hospital overcrowding or we hear about nursing shortages, but we don't often hear about home-based care, and it feels like it's overlooked in a lot of policy discussions. Why is that? And you just basically said that we don't care.
I think there's, I mean, and Jake might have a additional perspective too, but there's a lot of need. I mean, our hospitals have a ways to go to function well. Our clinic systems have a ways to go. Our aging system has a ways to go.
Yeah, but
So,
why is home-based
so
care
unless,
overlooked so often? I just that's a problem.
yeah, unless our policymakers are directly impacted, like Jake said, it's hard to get people's attention. I don't know, Jake, would you have other comments to make there?
I mean, I think at its core, a lot of people just expect care to be provided for free by women family members. And that's the way people have thought for a long time. And so women, and especially women of color, have served as the glue that kind of allows our society function to providing the care to not just people who are older and people with disabilities, but also kids, that allows the rest of us to go out and work and make the economy function. And so at its very core, I think this is overlooked because people just assume, this isn't a profession, that this isn't skilled work. They just make assumptions about who should be doing this and whether or not they should get paid for it.
I think there's also, a misunderstanding of how this whole sector works. When I was the director of an assisted living, the number of people that would come in thinking that Medicaid would just cover their assisted living rent
Right.
and services and that they were just going to be taken care of and that there'd be an apartment waiting for them. Um, so until you've started looking and you start realizing that it's actually really hard to get an assisted living apartment, it's hard to find a home care worker. You kind of people believe there's an entitlement system there, and there really isn't.
Yeah. I mean, if I could let every person in the country know that Medicare doesn't really cover long-term care, boy, I mean, that'd be a big part of our job done right there.
Yeah. Let's go back to the providers themselves. Are there still are there agencies out there that are relying too heavily on outdated hiring and retention strategies?
It's really hard to keep up with. It's hard to be proactive when you don't have stable staffing and you're kind of spending your day putting out fires, whether it's related to staffing or regulatory changes. But it can be really hard to keep on top of that. So yes, and a lot of the retention and even recruitment components start to look at your organizational culture. And when that revolving door of staff and revolving door of leadership is occurring, it's hard to have a quality culture. Um, I also think, one of the other pillars in our five qualities is around real opportunity. And that's something that we're really lacking in home care, but in the entire aging services sector is this ability to grow in your career. And so, um, when your credential only allows you to work in your state and only allows you to work within one service line, you get kind of handcuffed to that employer and that sector.
Mhm.
Um, and that doesn't allow for career growth. And then when employers are trying to build systems to better recruit and retain people, so I'm going to build a career pathway here at my agency, you're still tying that person to your agency. And so it's not real career progression. You can't carry it with you, and that's
Right.
just how it is in other sectors. You get more education, and it's tied to a wage increase. It's tied to a, job advancement increase that you can go get another job at that level, and that's not the case in this field. So that's a huge missing component when it comes to recruitment and retention in our field, is that it's not seen as a real professional job with real professional growth opportunities
Yeah.
because our system is so mishmashed across the country.
Yeah. So education for you, from your point of view, is important because it's something that you can carry with you every place that you go.
Absolutely, as long as it is tied to wage progression.
Right. Okay. That makes
Mhm.
sense. Can you speak to anybody that you know of that's having some success in this area?
You we see pilots around the country and we see states implementing programs and things that are great. It's just that one of the biggest challenges I see is that there's no cohesion, there's no tie, there's no systemic change. And so for one provider to implement something really great, that's great. But when it's not portable to other service lines, other states, other employers, it's not benefiting the system overall. So we're still missing that whole systemic look. There is some really good work being done. And one example of that would be the geriatric workforce enhancement programs. They're looking at creating apprenticeships for direct care workers, but there are several states working together on this effort.
Mhm.
And so the idea of having, again, portable, transferable reciprocity between states is really key. And so there are some examples of that.
So let me ask Jake this, and I've sort of addressed it before, and I'm truly not trying to fearmonger, but I talk to enough people who kind of talk the same way. Are we heading towards a breaking point of some kind? I mean, this doesn't seem sustainable. When you know that, what is it, 10,000 people a day are turning 65. We're getting older. California in particular is getting old quickly. And and at some point we're going to hit a wall. Is that inevitable? And how do we avoid that?
Yeah, I mean, it's bad now, and boy, are there challenges coming down the road. I think one thing to make sure everyone understands is that California is not unique in facing these home care issues. This is a national issue. It's happening in every state. Now, California is very large and it's very visible what the problems are, and I don't mean to say that's different, but just to be clear, the scale of this problem is far beyond California, and the federal government is not doing us any favors over the past year or so. So we have, over $1 trillion in Medicaid cuts that are going to affect reimbursement. We have these narratives around home care work as being waste, fraud, and abuse, which really cuts into public support for this work, and I think, besmirches the workers who are doing this labor. We have immigration restrictions and deportations that are affecting a home care workforce where more than 1 in 4 workers nationwide are immigrants, and nearly half of workers in California are direct care workers are immigrants in California. Then we have the kind of the federal infrastructure that supports direct care. The agencies are losing their funding. They're losing their staffing. Those folks who try to coordinate and kind of pass along best recruitment and retention practices to states and providers, those folks aren't there anymore. Um, we also have just a general rollback of workers' rights for direct care workers. So, home care workers losing minimum wage and overtime protections, losing the kind of robust protections around being an employee rather than an independent contractor in a lot of cases. All these pieces kind of add up to just an incredible set of challenges at the federal level that are kind of forcing us to a point where something's got to give. Everyone's kind of working on the edge of possibility right now. I think, that being said, we're so excited by a lot of the good things that are going on around the country. So
Name one.
uh, in New Jersey, just a few months ago, released a strategic plan to strengthen the direct care workforce. And that plan was about a year's of work from a bunch of different agencies. And so Mark earlier asked, like, what do policymakers not get? Well, one thing they don't get is that each of them is seeing part of the puzzle, right? You might have the Medicaid agency that does reimbursements. You might have Department of Labor that handles apprenticeship and recruitment. You might
Mhm.
have the Department of Ed that oversees training. So you have different parts of state government who aren't talking to each other necessarily, who aren't coordinated, who don't see this workforce as a whole like we do. And so what New Jersey did is really got all of those folks in the same room, and they looked at what are good ideas from other states that we could implement here. And they put together a set of around 40 recommendations for what the state could do right now to increase recruitment, increase retention, make these better quality jobs, create career pathways for the workers. And more than just it's one thing to put out the recommendations. That's great, round of applause. But they've actually started implementing it too. So the state is taking actual steps to take pilot projects and start to expand them to figure out how are we going to fund this long term. We know we have an aging population. We know we need resources to help care for them. Where are we going to get that from? So all those pieces that are so vital to making home care work, I think that cross agency, lots of stakeholders, strategic planning process is a
Mhm.
really impactful way to figure out what a state needs and to start actually checking those boxes.
So in general, after hearing that, are you feeling generally optimistic, both of you, about the future? And be honest. We hear a lot of negative talk about home-based care, and because it's tough. But it's always been a tough business. And it's just not getting any easier. And in your minds, what are you optimistic about?
There are a lot of good things happening, good pilot programs, states that are actually talking, that have state departments that are talking and working together. And so the problem we're trying to solve, at least, we believe that we don't have to start from scratch. We don't have to try to dismantle everything. What we're really trying to do is connect the dots and build upon systems that already exist. And so there's all these fragmented pieces out there that we can work together to align, and we can develop one coherent system. And that's part of our big flagship work at PHI right now is our Universal Direct Care Workforce initiative. And this is something where, we're looking at training requirements, we're looking at inconsistent credentialing, we're looking at advancement pathways, we're looking at wages and tying wages to those credentials. And so I think there's a lot of good out there. It's just that it's so scattered. Our work is to connect. And the other thing I do want to just call out is that we work with a lot of providers. We work in a lot of states. We work with a lot of caregivers. And I have to say the population that works in this sector is so incredibly amazing. They're innovative, they're scrappy, they are hardworking, their hearts are in the right place, and it's hard to think that this whole thing could collapse with these folks as leaders. They're amazing, and so I think there's a lot of good out there that will happen, but it's gonna take us all coming together to make it
Yeah.
happen.
Well, and that's quite frankly what CASA is as an
Yeah.
organization here in California. It's about providing support to, to the membership, but it's also us coming together and supporting each other and speaking with one voice up in Sacramento. Listen, before I go any further, I want to just take a minute here to acknowledge and thank our presenting sponsor, Access, for their leadership and support of California's home care community. When it comes to utilization and compliance and managing care in real time, it's pretty clear you can't execute on any of this without the right infrastructure. And that's where Access really stands out. With more than 9,000 organizations using Access to care for 5 million patients, 5 million, and certifications like High Trust and CHAP Verified, you're not guessing, you're operating with confidence. So if you're serious about adapting to where home health is going, Access should be part of that conversation. If you want to get more information, just go to access.com, AXXESS.com. Okay. I would like to know, for providers who are listening right now here in California, who are just feeling overwhelmed, what would you say to them?
Yeah, I'll start. I think I see two pieces to that. One is we know you're working within a failing system. We know that. Like we see you, we see the margins you're operating under, we see how important the work it is that you're doing, and we know how little support you get. Like we see that. That's real. There are resources out there. I know it's tough because it takes time to find and then use resources. But I think a really quick one Jenna mentioned earlier is our 5 pillars of direct care job quality. It's a simple way to categorize and think about different interventions you can do at the provider level to try to make your workers' jobs better. And in doing that, improve recruitment and retention. So there is some low hanging fruit, if you will, best practices out there that you can take off the tree and you can implement. That doesn't fix the system. I know that. But there are folks like us, and we would hope many of your providers would keep an eye on what we're doing. And when they're in Sacramento, to try to speak with one voice about what we can do at the systems level to make sure these services are funded and the workers are respected, and that we are strengthening the system and not continuing to kind of let it rot or let it fall apart.
Yeah, I mean, the advocacy piece I think is so key because a lot of our issues are tied to policy. I also would really advocate for looking at how they are supporting their staff. When, you know, 60% almost in California are relying on public assistance programs, um, 36% are in poverty. Um, these are folks that need a lot of support. And if you can't provide higher wages because you're tied as the employer, are there other things you can do? Are there rideshare programs you can design? Are there childcare solutions of looking at can people bring their kids to training opportunities? Is there something you can do if school is called off for the day unexpectedly to be able to help people with childcare so that they can get to work? Are there, better healthcare options you can offer, mental health support you can offer? So just looking at those kind of non-wage benefits that
Yeah.
can continue to support people, I think are really key.
I spent almost 2 decades in home health and hospice. And I think one of the things that I always found difficult from a culture standpoint was your staff are out of the office. They're not there.
Yeah.
So it can be really challenging for agencies, I think, providers to try and build some kind of culture because they don't have, like I said, the people aren't there. Any thoughts on that?
There's some interventions that we're seeing. There are some technology interventions and chat functions and video functions and things like that. But I think what's most powerful is offering some advanced roles that you can move home health aides into. So, for a couple examples, there can be peer mentor roles, there can be navigator, caseworker type roles, or one that we offer through PHI is called the Care Integration Senior Aide. And so, just making sure there are home health aides that are literally there that are positioned to support their peers, that are
Mhm.
able to go into the home if a caregiver is struggling with something with a client. They're able to do, phone call consultations with people in real time if they need it. So I think being able to offer that type of hands-on support is really key, not only for the caregivers in the field, but then it also offers that career mobility component too. The challenge and the pushback on that is always, well, how do we pay for that kind of role because we're not reimbursed for it,
Right.
right?
Exactly.
Yeah.
Exactly.
Yeah.
So it comes back to reimbursement again. It comes back to how much can I actually afford to do?
Mhm. Or what grants can I find? What other types
Right.
of funding can we secure, to Jake's point of looking for those resources?
The one thing that keeps coming up in this conversation is this: the workforce is not separate from quality care. It is the quality care,
Mhm.
right?
Yeah.
Absolutely.
So you can have great compliance, you can have great systems, you can have great technology, but if there aren't enough trained, supported, emotionally healthy people delivering care in the home, everything else just kind of starts to break down. That's kind of what I'm getting from this conversation. Yeah.
Yeah. Yeah, that's
Yeah.
exactly right. And Mark, you were asking about kind of I don't know if you call it the social aspect or the community element that can be so difficult when you have workers working in individual homes. And I thought Jenna provided a really great set of ideas for the employer level. But I also think there's when we talk about state policy, there's also larger interventions that can be done. So recently, the Heldrick Center at Rutgers University in New Jersey had a pilot project where they were training new home health aides at a variety of different positions. They were making that training free for them. They were providing a stipend to pay for transportation and childcare to make it easier for people to go through that training. Then they assigned them peer mentors. Those peer mentors got a little bit of a wage bump through the program. And those were peers who were able to help new folks kind of figure out how to operate at that job. They could go with them to work with a client so those folks weren't alone. They were available by phone to talk about different issues that were coming up. And folks often have a supervisor. I don't mean to glide over that, but that peer mentorship is kind of a unique position where it's not your supervisor, it's not your boss, but it's somebody more experienced than you who can kind of lead that help. In addition, this program, and they didn't think this was going to be a thing at first, but they kind of stumbled into it, is that all the trainees who went through this program, all the home health aides, they were put into essentially like a social site that they had created. Initially, this was just to share new training opportunities. So, they were going to offer a free dementia care specialty training, for instance. But in doing that, they realized this was also a space for workers just to talk to each other, to vent a little bit, to hear about new opportunities, to know who in their community would help them apply to Medicaid. Just provide resources. And Wisconsin, I think they have a really innovative universal home care training program. And through that program, anybody who goes through it can opt into this state matching service registry that helps them find employers to work for. It helps them show off the different trainings they've got, and it also helps them connect with other workers. And so there's that the employer level community, but also I think there's room for the state to fund and to create ways for home care workers to really connect with each other, to learn from each other, and have some kind of community solidarity.
Yeah. Jake McDonald and Jenna Kellerman from PHI. I want to thank you both for carving out the time to have this conversation today. And thanks to all of you for listening to At the Table with Casa. If you found value in this episode, please share it with your teams, your colleagues, and your industry partners, because these conversations do matter. You can listen to At the Table with Casa on Apple Podcasts, Spotify, YouTube, or visit casa.org for more information. My name is Mark Wilson, and we'll see you next time at the Table with Casa.